Good morning, everybody. I think we are ready to get started. Thank you all for joining us today, and a really big thank you to Tompkins for supporting this seminar on mindful heart around stress management. Just a few logistical things for your viewing pleasure. On the top right of your screen, you'll see a few dots, and if you choose the speaker view, you'll have the best view for the seminar today. Please keep your microphone muted as our presenters present, but please feel free to type all questions in the chat box. So without further ado, it is my pleasure to welcome Mr. Jerry Klein, the President and CEO of Tompkins Mahopac Bank. Thank you for being with us today, Jerry.
Thank you, Danielle. Appreciate you having me, and welcome everybody to our American Heart seminar on stress management, part of our Lunch and Learn series. And I'll bet that some of you find it ironic that Jerry Klein is kicking off the meeting on this particular topic, but I think it goes without saying that Tompkins Mahopac Bank and all of our affiliates support the American Heart Association mission to be a relentless force for longer and healthier lives. And here at the bank, we've developed a culture of health, but we certainly recognize that this past year has been very stressful for many of us. And the lingering effect of the pandemic has impacted the way we do business and, quite frankly, the way we take care of ourselves in some cases. And chronic stress has shown to be associated with increased levels of cardio events. So something to take very seriously. But we wanted to let you know that we're certainly thinking about you and your families, and our hope is that this presentation from the American Heart Association, as well as their other resources, will keep all of us and our families much healthier. So with that, I'd like to turn it over to Dr. Massoff to begin the presentation.
Thank you. I'm Melinda Massoff. I'm a psychologist at WestMed Medical Group. I think if you live in Westchester, you can't really drive anywhere without seeing a WestMed building somewhere. I am also a mom of 3 children. This was supposed to be my empty nest year. It turned out to be my full nest year. And although I'm in my office today, you'll see me in my office very shortly. I've been practicing out of my bedroom for a year. And I've been on a screen every day for the past year. I wish I could see you all in person, but happy to speak with you over Zoom. Okay. And thank you, Jerry. All right, so we're ready for the next slide. I wanted to add also, my sister-in-law is a retail banker in Arizona. And so she's had a really stressful year. I know you're helping with people who are having financial difficulties. You're helping with small business loans and really just, life and death. So it's been probably a really rough year for all of you. Today's goals are really to talk about the difference between stress and anxiety, talk about some ways to manage stress, and what to do if you need help. All right, you can go to the next slide. Let's see. And I think I forgot to mention earlier, I'll just mention it now. I love that this is an American Heart Association talk given by a therapist. It kind of illustrates that there's this false distinction between mind and body, that below the neck you go to your doctor, but if you're worried about stress, you talk to a therapist, and really everything should be integrated. And that's why I like working at WestMed, a big medical practice. All right, so back to stress. So stress is just a normal response to things that we, to events and things that we encounter. Like when you go to log on to this Zoom meeting and you can't get on the meeting for whatever reason, we encounter stress all day long. And there's stress with a little s, I think about, or capital S. And of course, living in a pandemic is stress with a capital S, already on top of all of the other stressors that we have in our lives. And we are wired, our bodies and our brains are wired to deal with stress with our central nervous system. And I bet a lot of you have heard of the fight or flight response. It's actually the fight or flight or freeze response. When I was growing up, I didn't hear the freeze part, but that's when there's something really scary or stressful. We either fight, flight is running away, or we just freeze. And so if we've just eaten a big meal, we'll stop digesting, our heart starts pumping so we can run away, we get sweaty, all of those responses that I'm sure you've all experienced. And the additional stressor of COVID is usually when we experience a stressor, we have this response, we deal with the bad thing, and then there's back to baseline rest. And so with COVID, we're not really getting that. Our bodies are being kind of assaulted on almost a daily basis with something. So it's really hard to get back to baseline. All right, so we can go to the next slide, I think. Okay, so just like stress, anxiety is also normal. It's a normal feeling that we have. One of the, I'm giving a talk today, so I had a little bit of anxiety about giving this talk today. That's very normal. It helps me mobilize. It helps me prepare for the talk. We get anxious before big meetings, big tests, and that really helps us to mobilize. Anxiety is something that I didn't make a curve. I didn't want to be technical. I didn't want to add any kind of like a chart for you guys, but it's really good to be in the happy middle place. You can't have too little anxiety because then we're not really motivated to do anything, but we can't have too much. We want to be in the happy middle place. And stress and anxiety go together, and we're used to both of them over the past year. All right, we can go to the next slide. So the reason for this talk today is that stress and anxiety really, really affect our bodies. Here's a list of some of the ways in which we are affected. Normally when we're in a kind of a steady state, the cortisol is just a little tiny drip in our body and we're maintaining the steady state. But when we feel stressed, we get a cascade of cortisol, which is the stress hormone. And that can increase cholesterol levels, triglycerides, blood sugar, blood pressure, and all these changes that I'm sure you all are familiar with, contribute to cardiovascular problems, to heart problems, and add to the buildup of plaque in our arteries. So what do we do? What can we do about this? So one of the best things is to move, to go outside and take a walk every day. I learned from meeting with a nutritionist, and actually I would encourage you guys, if you have that benefit with your insurance, to meet with a nutritionist, it would be a really great idea. I thought I knew about nutrition, fats and proteins and carbohydrates, But it was really helpful to have 1 or 2 sessions. And I learned from my nutritionist that a 10-minute walk after every meal can lower cholesterol. Who knew? I didn't know that. So, and the other thing that I learned was whenever you eat a carb, you want to eat a protein with the carb, and that keeps your blood sugar steady. So we want to be moving every day. I stole that motion is lotion and rest is rust from my physical therapist. It's true, we're machines, we have to be moving. And if you guys are sitting as I do all day, every day, it's really important to move. Another thing that we're missing a lot is fun things on the calendar. You know, during, at least we are moving into the warmer temperatures, so we can at least plan some activities that we can do with other people. And we can actually start interacting with other people as people get vaccinated. I loved the, while we were waiting for this talk to begin, there was a shot of a gentleman doing a yoga pose. And if you haven't tried yoga, it would be a great thing to try. There's so many online yoga classes right now, and some of them are free. And I'm getting a spam call. Sorry about that. Okay. A lot of the towns offer some free, easy yoga classes. Some of them are, you can be in a chair to do. And I feel that I can't recommend something unless I do it myself. So I do yoga myself, and I find it really important for stress management. I already talked a little bit about eating well. It's really easy to turn to junk food, all the comfort foods when we're feeling so stressed out, but they're not so good for us. So if you can add, you know, the basic rules are eating the rainbow, you know, eating more fruits and vegetables, trying to eat more freshly prepared food versus processed food. And then if you do, you know, try to limit the junk food to once a week. Sleep is so important. It's kind of the linchpin. When people come to see me, if they're not sleeping, it's almost impossible to diagnose someone, because so many things that look like depression or anxiety or even ADHD are really due to lack of sleep. You know, if you're really not sleeping, it's worth talking to someone. I just want to make sure I'm talking. Oh, I wanted to mention as well, because I ran into one of the internists just the other day. He is seeing a lot of fatty liver disease among women under 40, which is due to too much drinking. So I'm also suggesting everyone kind of like, I know everyone's been doing a little bit more drinking during the pandemic to kind of like decrease the drinking for your health. I'm not, I guess I'm going to be alerted if there are questions, or I guess we'll just have questions at the end. So how do we know if we need to talk to someone? If you're finding that you're worried all the time, you're just worried chronically, you're really not sleeping, and you can have difficulty sleeping, both falling asleep and staying asleep. If you're noticing increased irritability, difficulty concentrating, restlessness. I know also these are, I've seen a lot of these symptoms as well as just like byproducts of living through the pandemic, that we're all kind of feeling this way because of the pandemic. Feelings of panic, for some people that is like you feel like you're having a heart attack, or you feel dizzy, you feel like you can't breathe. And that's when it's not due to something medical, that's a panic attack. It's a very intense feeling of anxiety. And anxiety is very physical. We often feel it in our body. Low mood, hopelessness, feelings of guilt, feeling bad about yourself. Those are symptoms of depression, or obviously any suicidal or morbid thoughts. I also wanted to mention, before we get to the when can I get help, I just remembered that I had a really good definition of mindfulness, and it occurred to me that this talk is the mindful heart, and I just wanted to share that definition with you, and it's going to be in the chat. Let's see. Okay, and I'll read it to you. I'll read it aloud. So I know mindfulness is one of those terms that's kind of out there in the world right now a lot. But it's hard to really know what it means. So I heard this definition on the radio and tracked it down. It's a way of looking at the world without bias, fears, or assumptions. It's focusing on everything so that we're with it as it actually is. With pleasant and wonderful things, sometimes we're so distracted we don't get to enjoy them. With painful and difficult things, maybe we add on shame and blame and dread and all of these things that make it the bad or difficult situation much worse. And with neutral experience, just ordinary routine, sometimes we rely on intensity to feel alive, so we can get a little bored. So mindfulness is about changing your relationship to everything, not changing the thing, but your experience of it is different. So let's see. Let's return to, so if you're feeling like the stress that you're feeling during COVID is a little too much, it might make sense to go talk to someone. And you can really just have a few sessions with the therapist to feel the benefit. You don't have to, it doesn't have to be such a long-term situation. And there are lots of different ways to get help. I always tell people to start with their primary care provider, because they often have a list of referrals. They often have folks they can refer you to. Another option is psychologytoday.com. They have a therapist finder function where you can specify your zip code, your insurance, and kind of look at people's bios. That's an easy way to find people. You can call your insurance company. You can ask family or friends for recommendations. And I don't know if Tompkins has an employee assistance program. That might be a way as well.
We do.
And they're sometimes just talking about what's going on out loud to another person who's neutral is really helpful. I've noticed over this pandemic that just some people have, come in for 1 or 2 sessions just to kind of unload. And there's some utility to that. Generally for stress and anxiety, as I said earlier, it's a mind-body problem. So to help with that, stress response, we encourage people to kind of do relaxation, either using apps or doing yoga or just breathing. And then a lot of the times our anxious thoughts, our anxious feeling is coming from the thoughts that we're thinking. And sometimes it's helpful to kind of figure out if our thoughts are a little distorted, and that's how therapy works. So anyway, that I'm gonna now open up to questions, and I'm happy to answer any questions that that anyone might have. So let's
Sure.
see.
Melinda, one of the questions that we have in the chat box is, do you have some favorite apps that you would recommend for mindfulness, exercise, or eating better?
So sure. So for mindfulness, there's Calm and Headspace are the big ones that people have heard of. And some of them are offering or had offered some discounts during the pandemic. There's another app called Insight Timer. I guess I can type it into the chat. And Insight Timer is a nice one. People upload content to it, so it's completely free. That's why I like it. And you can search within it for different types of relaxations, and also they're divided by time. They're divided by, there are pain management ones. There are all sorts of different relaxation exercises. And then the goal is obviously that people are providing the content because they want you to follow them on YouTube. So that's how it's free. And you kind of have to listen a little bit at first to decide if you like the voice of the person who's leading the relaxation. But I've definitely found some very nice ones because there are hundreds. So those are really the big three. There are, gosh, I don't really know of a nutrition one. I was using one and I can't remember. I just, because I don't use one. But there are lots of also ways to log your moods. There are tons of apps out there for mental health as well. Any other questions?
Do you have any recommendations to practice mindfulness throughout our daily lives?
Oh, sure. So there's a concept of mindfulness homework in therapy, and really that would be just doing any activity that you normally do and you do it mindfully. An example would be, in olden times, it was eating a piece of cake. So we're not talking about cake because this is a talk for the American Heart Association. So we're going to talk about, so maybe eating a salad, a beautiful salad full of, protein and nuts and delicious things and peppers. So you're using your five senses and you're in the moment. So what does the salad look like? How does the salad dressing smell? How does it feel when you're cutting through the salad to put it in your mouth? What does it feel like in your mouth? So anytime you're using your five senses to be in the present moment is a way to practice mindfulness. And when you're doing meditation or relaxation, you're in the moment breathing. Oh, I just want to add this important thing about apps and relaxation. You're going to be terrible at it because our brains think thoughts all day. That's what our brain does. If you were good at it, you wouldn't need to do it in the first place. If you were good at meditating, you wouldn't need to do it. So the biggest complaint I get from patients is, I tried the app you suggested and it was terrible. I was terrible. I can't do it. So my answer to them is, great. That's how it's supposed to be. You're supposed to be pinging all over the place. And then whatever voice you're listening to says, come back to your breath, that's like weightlifting for your brain. That's what helps. So it's okay to be terrible.
We have another question in the chat. And is there anything you can do during the day to help you sleep better at night?
Oh, yes, great question. I'm so glad that someone asked that question. So sleep is really complicated. There are two hormones in our body, at least, that are relevant with sleep: adenosine and melatonin. I know everyone knows about melatonin because you can buy melatonin supplements in the pharmacy. But adenosine is the chemical that helps us fall asleep at night. It's stimulated by sun through our eyeballs to our pineal gland. And so a walk in the morning is a really great thing you can do for sleep at night. So you want to, if you can, if your schedule allows this, you want to be outside for at least 15 minutes getting sun, and it works even if it's overcast, to start the production of adenosine. It also clears the melatonin out from the night before. It's really refreshing. It's a great way to start your day. And if you really want to walk every day, get a dog, because that will make you go walk your dog. And moving helps when we're all sedentary. You know, we need to get tired during the day. You'll see, I know if anyone has kids at home, when they're not going to school, it's harder for them to go to sleep at night. So that's my recommendation for sleep: moving, getting out, getting some sunlight.
Awesome. And during your presentation, you talked about getting exercise. I know that the American Heart Association recommends 150 minutes a week, and that can be broken up into any duration during the day. But the idea is just to get moving. So can you help suggest any ways to help people get moving?
Sure. It's anytime you can move, you should. So if you're sitting at your desk doing some stretches, I think there's a really good, oh gosh, I can't remember what it's called, but my nutritionist gave me a website, I can't remember what it's called, but you can find some stretches to do at your desk. Maybe set reminders in your phone to get up and move, and don't ignore them. Because sometimes I do ignore my Apple Watch reminders. Make plans with people to go walking, make it social. Try to, baby steps. You try to incorporate more and more movement into your day. If you have a meeting, can it be a meeting while you're walking around? Park far away in the parking lot so you have a longer walk. Not everyone loves hard cardio in the gym, but walking really is fine. And a little bit of weight training, particularly for women, to avoid osteoporosis.
Awesome. Thank you so much for that insight. And the final question that we have is, do you have any easy breathing exercises you can do when you feel the stress level rising?
Oh, yes. And I can demonstrate them right now. The other thing I want to say about the breathing is you don't want to wait until you feel super stressed out to breathe, to do the breathing apps. You want to incorporate the breathing practice as something you do when you're feeling okay. It's sort of like you don't wait to the Olympics to practice the sport. You want to be practicing the sport before you get to the Olympics. And then if you're doing the relaxation, if you're doing the breathing, then you find when you're stressed out, you can really pull yourself out of that fight or flight much more easily. And it's really easy to do. And you don't need an app to do it, because we can breathe. We can breathe without an app. So what you're going to do is put one hand on your chest, one hand on your belly, because we tend to breathe shallowly with our chest, and the goal is to breathe deeply with our diaphragm. So you're breathing in slowly, so to inflate your diaphragm. So the hand on your belly is going to move out a little bit. And then you're just going to breathe slowly out. And breathe in. And breathe out. Breathe in. you can do this anytime. Sitting in the car, sitting at your desk, when you're going to sleep at night. So
Just a few breaths there. It definitely makes me feel calmer. So thank you so much. Thank you so much for sharing your expertise with us today. I have one other comment in the chat that I just wanted to share is from Nancy, is that you guys have a great EAP program with 8 free counseling sessions per issue for you or a family member. So as you know, we go into the future, we would just encourage you to take note of your stress level and manage it the best you can. And there are tons of resources on heart.org. Thank you to Megan for putting a lot of the resources right here in the chat. But you can always reach out to us if you all need anything else. So again, thank you, Melinda, for presenting today. And thank you, Jerry, for opening us up. And thank you all for joining us. We hope that you have a great rest of your day and that it's stress-free.
you're welcome. Thanks.
All right, bye-bye, everyone. It's so amazing how, like, when you just focus on your breathing just for a few moments, it definitely changes the internal, feel the shoulders up by your ears can relax a little. It makes a huge difference. So thank you again for taking those few moments for everyone.
Yeah, I actually, you reminded me, I meant to do that and I totally forgot.
It worked out perfectly. So again, just thank you for joining us today, and we hope that you have a great day too.
All right, you're welcome. My pleasure. Bye-bye.
All right. Bye-bye, everyone.